Hello, I'm here again. I'm Hani Raghi, and I'm so lucky because I managed to grab one of the busiest people in this Congress, my friend Dr. Alaide Shefo, who is the president of the European Association of Percutaneous Cardiovascular Interventionists, the EAPCI of the European Society of Cardiology. But before that, she's always been the very able interventional cardiologist from Milan. Dr. Shefo had several important responsibilities in GIS this year, but it was particularly interesting to hear her concepts on antithrombotic therapy and also on mechanical circulatory support. So can you please summarize for us your presentations for those who were in other halls or are unable to attend them?
Yes, so first of all, thanks for this interview. And the first talk was regarding antithrombotics in high bleeding risk patient undergoing PCI. We know this is an issue. We have been improving in our procedure. Now we have finally recommended in our guidelines to have imaging based and guided PCI. But we were talking about what is in the guidelines regarding acute coronary syndrome that are in 2023, which were the evidence why we gave the recommendation to the different regimen of antithrombotics with anticoagulation on board or not. And this really tailored approach for our patient, because according to the risk profile of the patient, if it's more prevalent ischemic risk rather than bleeding risk, we have been adapting the length of the duration of dual antiplatelet therapy and always envisioning which is the antiplatelet therapy to recommend to our patient and how long it should be, and if there is anticoagulation, yes or no. So the approach from the guidelines is tailoring the patient risk profile. So in general, if they can allow, they can go up to even 1 year of dual antiplatelet therapy, but if they are at a very high risk and they have anticoagulation on board, they can stop even with the triple at 1 week and then continue with the anticoagulation in one of the two dual antiplatelet therapy. So there is all a modulation on the length according to the risk profile. And then the latest, we touched the issue of what about indeed antithrombotics in women. We did publish a very nice scientific document by EPCI on antithrombotics in women. As we know, they are usually underrepresented in all the clinical trials, and they are at quite high bleeding risk, especially in some specific age.
Yes.
And we were touching also this point.
I can't think of anything more important. So let me ask you specifically about this. So in a very busy cath lab, do you think we should have a dedicated person who should sit and take a very good history and tell us which patient profile should fit this particular antithrombotic regimen? Or do you seriously think there's a need for something like AI to do it for us?
That's a good point, also because the talk was regarding acute coronary syndrome. So in acute coronary syndrome, especially if you have ST elevation MI or very high risk non-ST elevation MI, the patients are brought immediately to the cath lab. So sometimes we don't have time really to go in details on the risk profile. And in that case, we have just to apply the guidelines,
Okay.
You go heparin at the beginning, and then if there is an indication for primary PCI dual, in case of non-ST elevation MI, indeed you have to understand if there is indication for PCI or surgery, and there is a different class of recommendation. What we can do is later than procedure, because clearly tailoring the length and which antiplatelet therapy to give should be done clearly. If you are lucky, I'm a big academic center, so I have a lot of colleagues that help me in the wards. In this case, they should be very meticulous in the anamnesis of the patient. In other, less lucky academic centers, many people clearly also creating algorithm with artificial intelligence should be the future. Should be done.
Thank you. So let's go to your second major presentation. because you are also, you have a huge experience in practice, in working in shocked patient, but you also are involved with the guidelines and with the, with probably the largest interventional cardiology society in the world. No offense to anybody else. So tell us more about mechanical circulatory support in your daily practice and in the guidelines and your presentation.
Yes, so I was honored to be task force member in both acute coronary syndrome and CCS guidelines as representative of EAPCI. So I had this huge privilege. Clearly, guidelines are based on trials and data. So
Yes.
you get recommendation from guidelines only if you have clear evidence. And at the time of the publication of acute coronary syndrome, we did have only natural trials. So the natural trial came
Yes.
from EABP shock and the natural trial came from SELS shock. So that's why we downgraded the recommendation for MCS in general to 2BC.
Right.
In the meantime, they were published the danger shock trial. As you know, this is another investigator-driven trial done by this amazing group of investigators in Denmark and in Germany, and they did demonstrate the advantage on mortality of the usage of one MCS specifically, which was the microaxial flow pump CP in patients admitted with acute MI complicated by cardiogenic shock. So after the guidelines, we have a randomized trial. And what's happening in real practice? In real practice, clearly this changed the attitude of the center. And my center is a big cardiogenic shock center, is an hub center in Milano. And we are exactly using this MCS, so microaxial flow pump CP in acute MI complicated by cardiogenic shock. We are working as EAPCI in an update of our joint document with ACVC, and clear we took into consideration in this update the new evidence from the danger shock trial, as well as all the other publication, waiting from the new guidelines. There will be first with heart failure and then with acute coronary syndrome in 2026 and 2027. That will be most probably updating the class of recommendation of these devices.
Thank you. That was fantastic. One last thing, some football trivia, because she's Italian, so we have to talk about football. People wonder, she's in Milan. Who is she supporting? AC Milan or Inter? But let me tell you, neither. She's actually supporting the best team in Italy, which is Torino. Am I right?
No, I'm supporting Napoli.
Napoli.
Because I was
Yeah.
born in
Yeah,
Napoli.
Napoli. I
And
made a
you see
mistake.
also on
Yeah.
my X account, you will see that I'm Napolitan and Italian.
Exactly.
So I'm supporting Napoli, even if I have to say I'm not such
Napoli
a
is where Maradona went, right?
Yes.
Yeah. So this is the champions a couple of years
But
ago,
also champions of last year. We
and
won
last
the
year as
championship.
well. Yes.
Won the
So
championship.
remember, guys, she's in Milan, but the best team is Napoli.
Sorry.
Yeah. Thank you.
Thank you.
Thank you so much.